Canada's rate of vaccination is right now among the world's fastest. We recently passed the United States in first dose vaccinations, and as of today, we're also ahead of the UK. But the picture is stark when compared to the developing world. The light blue portions of this map show the countries that are the least vaccinated. Just look at the entire African continent. And 1.3 billion people, only 31 million have received one dose. That's slightly more than 2% of the population. In the last couple of weeks, cases of COVID have begun to surge throughout Africa. Maria Van Kerkhove is the COVID-19 technical lead for the World Health Organization, and she is in Geneva. Maria Van Kerkhove, thank you very much for joining the program. It's a pleasure to have you here.
Thanks so much for having me.
I want to get your sense of where we are in the pandemic right now, and in part because I'm talking to you from Canada, where we are talking about our reopening plans. We look south of the border at our big neighbor of the U.S., and they are already reopening. But is there a concern that when we look at our own horizons, we're forgetting about what is happening elsewhere in the world?
Well, yes. I mean, we live in a globally interconnected world, and this pandemic is far from over in most parts of the world. Globally, if you look at the global level, we've seen a reduction in cases and deaths in the last 4 or 5 weeks, and that is really a good sign. However, if you look at each of the regions around the world, and at the national level and subnational level, the intensity of spread is really drastically different around the world. We have hotspots or areas of concern in all regions of the world, even in the Americas. South America right now, many countries are facing incredibly challenging situations. Countries in Europe and in the eastern part of Europe, countries in the Middle East, even countries in Southeast Asia are seeing some increases in cases. So we all continue to be at risk. And there's a number of reasons why we're seeing these challenges, seeing these increases in cases. And it's a combination of factors that are really leading to all of that.
Of course, vaccines are key to so much of this, and I know that Canada has provided funding to be able to buy vaccines for less developed countries, but has not actually donated doses to that COVAX effort. Do you believe it's now time for countries like Canada to do just that?
It is. I mean, we really need doses to be shared through the COVAX mechanism, which is a mechanism that assures the fair allocation, distribution of much needed vaccines around the world. And our goal is to ensure that those who are most at risk, frontline workers, health workers who are caring for COVID patients, putting themselves at risk for doing their jobs, plus those individuals who are of advanced age, who have underlying conditions, who are more at risk for developing severe disease, have access to these life-saving vaccines. And it is time for countries to donate available doses that they can.
As we focus on, figuring out ways to end this pandemic, there is greater attention being given to how it all started. There has been an effort recently announced by the U.S. president to look at the origins of COVID, and that includes the possibility, although there is not evidence to support this right now, the possibility that it was a lab leak. What is the position that the WHO has when you look at that American effort supported by the Prime Minister in this country to really get to the bottom of what happened, whether it was a lab leak or evolved out of animals, out of bats, or whatever it was? Where do you stand on that?
So we stand, I think, in line with everyone out there and all leaders around the world to really understand how this pandemic began. There is a great public health importance to really understand how these spillover events happen, how these types of pathogens enter the human population. From the beginning, this has been a priority of WHO. We've had several missions to China. The latest mission produced a very large report, which I hope your viewers have had a chance to even look at, which details a lot of information about the different hypotheses from a bat, from an intermediate host, looking at a potential lab leak. I mean, all of that needs to continue to be studied. And that's what our goal is. So the first phase of that work began, but it was nowhere near going to be complete. So many studies which are outlined in that report need to be carried out, and that will be phase 2. And so we're very much looking forward to continuing all of that research so that we really get to the bottom of understanding about how this pandemic began.
Now, I know you were part of the WHO advance team that went in February of 2020, in those very early days, trying to get a sense of what happened. What was your understanding at that point and the level of cooperation you were getting from the Chinese authorities?
So at that point, it was early February 2020, and there were cases that were still increasing in some parts of China and decreasing in others. And our main objective of that mission was to understand more about the virus, understand how it was spreading, understand what control measures were being put into place to control transmission, and to document as much as we could in terms of the detail, and publish that in that report that we reported when we came back from China. Our mission included visits to multiple cities. We met with doctors, we met with community leaders, we met with patients. We met with researchers who were carrying out clinical trials to understand treatments. We met with labs that were looking at development of diagnostics. So it was really a combination of things that we were looking at there, and we documented that in that report when we came back. We did have a small team that went to Wuhan. At that time, Wuhan was still very much in the thick of their epidemic. And so there wasn't work that was done specifically on the origins, although we did discuss the critical importance to study this, and we outlined there that that was something that needed to continue. But this is a process. It was never going to be one mission. It was always going to be multiple missions, and we really need to get back to it. We need to let the scientists get on with this, remove the politics from this, and really just understand how this actually happened, and much more work needs to be done.
We're talking certainly in this country, and we're not the only ones, about what the return to international travel looks like, what we would want for people who are entering this country, and the kinds of things around proof of vaccination. At this point, Canada has said, we will only admit people likely who have a vaccine that has been approved by Canada. Now, China's vaccine, Sinovac, is not one of those vaccines. It's just not part of the portfolio that we've been using. But I see the WHO has now granted emergency approval to that particular vaccine. Should countries like Canada be opening our doors to fully vaccinated people who have been vaccinated with that Sinovac, that Chinese vaccine?
So that's a good question, but these are national decisions. What we advise countries to do in any of the decisions that are being made to open up, including travel, is to take a risk-based approach. It depends is the short answer. It's an unsatisfactory answer, but it's a short answer. But what we need to take into account is the risk of travel, where people are coming from, where people are going to, and how we de-risk that whole travel process. Vaccines and vaccinations are part of that. But remember, much of the world does not have access to vaccines. The inequitable distribution of vaccines it's still quite grotesque. And if that is a requirement, we really are separating out the haves and the have-nots from that. So the decisions that are made by the Canadian government, or any government for that matter, need to take a lot of that into account. But there are ways where people are introducing testing, they're introducing restricted movement of individuals before they travel or when they arrive in a country. They're taking a risk-based approach of depending on which countries they travel to, depending on that risk. So it's a combination of factors. And what we advise are the considerations for governments to set those policies, because it's a multifactorial decision.
Ms. Kerkhove, thank you so much for your time. We appreciate it.
Thank you very much for having me.
Hi, I'm Vashi Capellos, host of Power in Politics. See more of our show by subscribing to the CBC News channel or click the link for another video.